Okay, so welcome to the Board of Health meeting on Wednesday, May 8th. Pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency signed into law on March 29th, 2023. This meeting will be conducted via remote means and in person, as long as members of the public can easily access proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but it may be watched when the show is replayed on YouTube. Members of the public wish to participate in the meeting may do so in the following manner. In person at the Rope Walk Meeting Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. Note occupancy limit of the room may reduce the number of attendees that can be accommodated. You may also send any comment or questions that pertains to an agenda item to publichealth@plymouth-ma.gov. They will be read on the air and answered by the Board of Health as practicable. If time doesn't permit answers during the meeting, responses will be sent by email as soon as possible. So I'm going to change up a little bit of the protocol after having been to the MAHB meeting.
Oh, okay.
So what was suggested was that for public comment, we should ask for public comment at the end of each agenda item that pertains to something the public might want to comment on. So there will be, and so that is going to be for members of the public who want to make comments. Usually, if they want to make general comments, there has to be a separate public comments agenda item listed, which some of the committees and boards do. And you'll see why we're doing that when we get to it. So first issue for us is going to be approval of minutes of the 10th of April. Does anyone have any changes, corrections to those? I don't see anybody saying anything. No. So I just need someone to make a motion to approve the minutes for the 10th of April.
So moved.
Is there a second? Lorenzo, can you second that? Okay.
Yes, I second it.
Then I'll just call the roll of those who are present. David,
Yes.
Lorenzo,
Yes.
Deb, I don't know if you were,
I was there.
then yes or no?
Yes.
Yes. Amy Palmer hasn't joined us yet, and Dr. Reed, I believe, is absent for this meeting. Then we'll do the same thing for the minutes from the 24th of April.
I know something to you there.
Don't have them? Okay. Then our next happy sort of thing is to introduce our brand new regional epidemiologist.
Yeah.
So welcome, obviously going to be employed through the Public Health Excellence Grant for Shared Services. So wanted to make sure everybody knew her. And so this is Devin. Donovan. I'm gonna step over that for a while.
That's all right.
Unless I put an I instead of the O.
Yeah, my mom liked the way the O's lined up.
Yeah. So what have you been doing? Can you give those who don't know you a brief hello and
Yeah,
describe?
sure. Hi, I'm Devin Donovan. I am originally from New Jersey. I have my master's degree in public health epidemiology from Karolinska Institutet in Stockholm, Sweden, most famous for handing out the Nobel Prize in Medicine each year. My background is primarily in substance use prevention, awareness, and education, and I wrote my thesis on HPV vaccine misinformation on TikTok. And the implications of that. So really thrilled to be here, to be working in Southern Plymouth County, and looking forward to working with the whole collaborative, which includes Plymouth, Kingston, Duxbury, Wareham, Carver, and Plimpton. So all of the towns will be sharing me, but I am thrilled to be here in Plymouth.
And I don't know who you have met and who you haven't met. I
Yeah.
assume you've met Karen. And probably Dana too. David,
I introduced myself at the beginning of the
Yeah.
meeting. Welcome.
okay.
Yeah. good to be here.
And Lorenzo, I don't think you've met Devin either.
No, I haven't. Pleasure meeting you, Devin. I also finished my MPH from the University of, or Benedictine University in Illinois. So I have a certificate in epidemiology and I focus on policy and just kind of health-related social needs aspect of it. I currently work for a hospital system, Cape Cod Healthcare. So
Very
welcome aboard.
nice to meet you, Lorenzo.
He also serves on advisory and finance.
Ah,
And
that's
Oh, yeah.
good.
I believe he's also a town meeting member.
No, can't be a town meeting member when you're
You can?
advisory in finance. I had to relinquish that.
Deb?
Welcome, Devin. I'm a registered nurse and I work for a group of physicians, working on their quality HEDIS measures. So I work on that aspect of, quality and health, but, welcome. What did you say you did your thesis paper on?
HPV vaccine misinformation on TikTok,
Oh,
the app.
good.
Yeah.
I'm sure there was a lot of misinformation on TikTok.
I'm sure.
Wouldn't believe.
And sitting directly to your left is one of our high school students from Plymouth, so high school, Lauren.
I read it before the meeting. Yeah.
Okay. And I know Dr. Reed won't be here, but I don't think you've met her.
I think so.
No, and Amy is coming a little bit late, you said. When she comes in, we'll have her introduce herself.
Oh, and actually, Devin, Amy did reach out to me and shared information for their epidemiologists. So you guys
Ooh.
can be FB buddies.
Yeah,
So I'm gonna forward that to you, I forgot.
yes.
Not only that, but I was contacted by the epidemiologist that works for the islands. Actually, and she's not the epidemiologist, I think she's the head of a PhD grant out there. She's their coordinator. And she said, oh, we have a part-time epidemiologist, maybe yours could work with us.
I
So,
would love to chat.
There's some connections.
Yeah.
I think I mentioned to one of the MAHB officials where you got your degree in Sweden, and they were like, wow, that place is world famous.
Yeah, it's usually people either are like, they know it, or they're like, oh, is that where IKEA is? I'm like, that is where IKEA is. It is there.
Oh, somebody's learning.
So anyway, welcome again. I assume that you're probably already busily going around to the towns and finding out what they want you to do.
Definitely. Lots of meetings on the book.
Hi, Amy. Just in time. This is Devin.
Hi.
She's our new full-time epidemiologist
Nice to meet
for the
you.
grant.
Meet you as
Did you
well.
get from,
Yeah,
so I'm
I
gonna, yeah.
This is the game we're talking about.
Making sure, yeah,
Great,
yeah,
yeah.
so if you have any questions, I know Kasha will definitely answer.
Yeah, I
them
would
for you.
love to reach
Yeah.
out, and I found there is like a regional epidemiologist group working in Massachusetts
Yeah.
that I've been burrowing my way into. So
Yeah,
I've
it's
been-
such an interesting position and it's so, like, I'm so curious to see how it is able to integrate in local health.
Yeah.
Because it's wide open, like, you guys can totally make it whatever you want it to be.
Which is-
And
yeah.
I know, which is
Right.
awesome. So congratulations and welcome.
Yeah, thank you very much. It's nice to meet you.
And I also mentioned, I think to Lauren, I saw your email
Oh, yeah.
about that high school student
Mhm, mhm.
public health program
Yep.
up in Tewksbury.
It's online.
Yeah, I know.
Oh, yeah.
And it looked interesting. And, there was like little boxes and things that you do as part of the program.
Yeah,
And so even if you don't have time to get that, it was in July sometime?
it is in July. It's a week in July. So,
So even if you don't have time to get to that, if you ran across anybody else among the high school students that have a kind of a budding interest in public health.
all the kids walking around with the I Heart Public Health t-shirts.
Yeah.
A lot of them. I have MHOA t-shirts. Do you have any of those that say public health saves lives on the back of it?
No, but I mentioned the video that was out about public health, the invisible shield.
Oh,
at the
yeah.
last meeting,
Yep,
which
yep.
starts off with a little thing that says, public health saved your life and you didn't
Yeah.
even know it.
yeah. I mean, that's the hardest part about public
Mhm.
health is that if we're doing our job, you don't see us.
Yeah.
So,
And therefore people ignore us.
yeah, basically,
Until something happens and then all of a sudden they find out. Anyway, next item of business is actually going to be a report. And among the things, you're gonna be able to start the screen share in a minute, because I can't do it without this weird reverberation thing going on.
Is that PowerPoint that you want?
Yep, but I also wanted to mention other things that came up at that meeting. So there was a Plymouth nuclear waste strategies and update. And our nuclear reactor was, of course, the main subject. There was a lot of liability discussion about protection from liability for boards of health and staff. There was some talk about how to properly conduct quasi-administrative and quasi-judicial hearings. But it wasn't clear to me if that's the same as a administrative public health forum.
I think it's different.
A different, a hearing has a result, meaning like, it's a hearing when they come before you and ask for a variance, that's a hearing. Someone is coming to ask you for something and then you vote on it, and then there's a determination. A forum is just a fact-finding mission and no votes taken.
And that's what we're doing.
Exactly.
Actually, also, they stated that at some of those quasi-administrative hearings, there may be no votes taken.
Right, it doesn't have to be, but there is, with the forum, there is no vote. It's more like public input, fact-finding, data collection, and then you bring it back to the board for a vote at a later date.
So the other thing that came up, which got everybody's attention, was these First Amendment auditors. So if you could do the screen share for that, I think it starts with that. And I think I already talked to Karen about that.
Have you guys had that here?
We also had one woman that came into one of our board of health meetings that was definitely falling into that category some time ago.
Was that when we were in the other room recently, relatively recently?
Yeah, I think it was actually.
I kind of remember.
So if you look at this, you notice the Massachusetts Municipal Association, is that the group that sponsored what you saw?
No, we did ask for our insurance company, MIA, so.
So anyway, you might notice the title. First Amendment audits, how to keep calm and respond.
Yeah.
So for those that haven't ever experienced this, a lot of towns have. What's happening is people come in under the excuse of defending First Amendment rights. And when they do so, they apparently attempt to record what's going on at meetings. And they're quite aggressive. And they're looking very, very carefully for violations of open meeting law. And for anything else that they think they might be able to criticize you for. And then apparently that after they make a video like this, they post it and they actually sell the rights to see it. So they make some money on it. So some people feel that they're defending First Amendment rights. Other people feel that, they're doing this just to sort of delay and block the actual operations of government bodies. And it gets to be a little bit trying because now there's rules. This was explained at the meeting also, and even Lauren heard this one. You have to allow people to speak. If you are allowing public comment, anybody can speak. You can't stop them even if it becomes offensive. And the only way you can stop them is to set a time limit for each person, regardless of their opinions, each person's ability to address the group. Then you can stop them. And then we're also told that if they fail to stop, even after you say, please, stop so that people can speak over and over and over again, and they still continue talking, then the only thing you can do is apparently to adjourn the meeting, or at least pause it for a break, and everybody has to leave the room that's on the board of the committee. And so you just leave everybody who's in the public there, and you walk out and you go hide someplace at another room, because they will follow you. And then you come back after a while and hope that they have given up and left. And if they did, you can continue the meeting. And if they haven't, you may have to adjourn it for the day. And that did happen in Salem, Massachusetts once, I know. They actually had to suspend the meeting and had to come back on another day to continue it. And then the person that was causing the problems was no longer present. So this can happen. I think on the next slide, that's the link. And anybody that belongs to a committee or a board, for a government organization or a town or a city, probably should review that. I looked at it, it's about a 1 hour video. But basically, that's what they tell you to do. And they tell you not to be baited into getting into a back and forth fight with these people, because you're not supposed to do that. So it can be difficult, but it's possible to get through it.
Yeah, our training was more geared to when they're in this building. You know, when they come into the town hall, or they come into the, you know, the health division, and, you know, they.
Have you had people come into town hall?
Twice.
Yeah.
Yeah, two different instances. So just, you know, protocol that we need to follow, you know, they can film, they can ask your name. They can stay there all day and film if they want, but we can also go back to work and do our jobs. We
Yeah.
don't have to engage with them. We don't have to have a conversation with them. We should just say, okay, great, you know, film away, and then go back to what we were doing.
In the meetings, it is common protocol that if someone is going to film the meeting in whole or in part, that they have to announce that they are doing so. You can't stop them from doing it, but everybody is supposed to know that that's happening. And if they fail to do that, I guess you can stop the meeting and say, excuse me, are you recording this meeting? And if they say, yes, I am, it's part of my First Amendment rights. You say, yes, it is, but we have to make sure that everyone is aware of the fact that you're doing that. And I don't think they can object to that. So things happen. And it can be rather difficult to get through sometimes.
We do that on our last forum. We had the press who was in attendance come up and introduce themselves.
Right.
Yeah. And I think I recall that at one of the meetings we had, I believe somebody from MAHB present, Mike Hugo, and somebody came in and was viciously attacking Mike Hugo and the state public health department and the MAHB. So there's a whole protocol for doing it, but just unlike what some people have done and they've gotten in trouble for it. You can't just say, you're out of order, you know, that's offensive, you know, you cannot, you know, confront people who are members of the board or other members of the public. And that could come up at our next public forum, because we saw one person doing that when we first started discussing the rodent control and the rodent sites. So she was within her rights to do that. But fortunately, Karen was there and Karen was keeping the time.
So in those situations, we set a time limit for every, you know, is it 3 minutes? Is that right? What we say?
That's common.
Yeah,
So we
I think
said
in the forum, we would give out to 5.
5.
But we also asked in the art, we placed the ad in the paper, and we did ask that they reach out to me if they wanted to be a speaker. Cause I
Right.
really wanted to get an idea.
Right.
You know, what I mean, if it's important to you and you want to be a speaker, well, then reach out to me, and then we'll know how many people we have.
Yeah,
If we have 5 people, we might give them 10 minutes, but if we have 20 people,
yeah.
you know,
everybody
it's
gets
good,
5.
exactly, you know what I mean? It's so.
Yeah, we can also have a sign-up list in the entrance. And at the beginning of the meeting, we say, anyone who wishes to address, you know, the meeting under public comment, please sign up your name and whatever affiliation you have, so we know who's going to speak, and then we'll follow the order that's on the sign-up sheet. So we can do that, and they recommend that also.
I am surprised that if people start saying offensive things that we can't shut it down.
Even if it's personal.
Yeah,
Okay.
yeah.
Even if they start saying stuff about you, your family.
Yeah, that's new to me, I
Yeah.
like that.
Yeah.
No, I don't think many people like it. but
No.
Yeah, no, I mean, it's
The
good.
courts have
Well,
ruled.
it's good to know, because my instinct would be like, all right, shut it down, but now.
Or call your reporter.
Yeah,
Yeah, I know.
yeah,
Yeah.
but now I know, actually, I know now that we have to shut it all down
Mhm,
and take off if it's an issue.
Yeah.
mhm.
And I guess you have to announce that you're going to suspend the meeting.
Who gets to do that? The chair?
chair.
Okay,
But you should really only do that for time purposes, even if you shouldn't shut it down
oh,
for
wow,
rudeness, because that's exactly.
No, this isn't- yeah.
I think it was,
There's Sarah, I think. wasn't it?
Southborough, I think.
Oh, South that took my court.
They went to the Supreme Judicial Court.
Yeah.
And the court was against the select board in Southborough because they shut it down for rudeness, not for time.
yeah,
So you have to be careful when you say, we're gonna suspend the meeting unless you will yield to other speakers.
Yeah, I mean, if we give someone the floor for 3 minutes and they wanna spend that 3 minutes calling me nasty names, they can do that.
Yeah,
And nasty language too. I kind of thought they might have said that, but they approved that too.
on the ND meetings, what they did was, they said, you get 3 minutes. If you want to speak longer than that, it has to go before a vote of the board members.
Yeah, you can do that
That's
too.
what we've done.
And so,
Mhm.
you can then have another, like, 2 minutes, so now you have 5 minutes.
Yeah, that's when you time it, and then when you say your time's up, and they'll say, someone might say, well, I have one, can I have one more minute, and then you guys vote, and you say, yeah, you can have your minute. And then the timer gets reset.
Yeah.
So it's pretty, I mean, it's flexible, you just hope that everyone behaves appropriately, but
yeah, I feel like this kind of nitty gritty stuff is, like, you don't go into a board with orientation of, like, I would love to be able to have okay, you're on a board, here's the rules. I know that they're probably written somewhere,
yeah.
but this is really helpful, thank you.
So they spent quite a lot of time at the
Mhm.
meeting discussing that, because it's happened a lot, apparently, and it's continuing to happen. Next slide. And the one after that. Oh, don't bother me. It's spam. So radon, there is going to be an MHOA webinar, I believe, about radon coming up. I forget when it is. But because radon has become such a public health hazard, I thought that we should go through a little bit at one of our meetings also. So what you see there is just something out of the periodic table, which ought to ring a bell with anybody that's had chemistry. Or still remembers a little bit of chemistry. If you go to the next slide, you also see that there's a link there. So what is it? A lot of people don't know about radon. They don't ever think about radon. It is a completely colorless, odorless, tasteless, and quite radioactive gas that comes from the ground, formed by the naturally occurring radioactive decay, usually from uranium, that's in the rocks and soils, which decays. And since it's a gas, it moves into both gas and moves into water and air. It's outdoors now all the time. It's very low levels in the outdoor and surface water, such as rivers and lakes, but it's found at higher levels occasionally in the air inside of homes and other buildings, as well as in water from underground sources such as private wells. So actually, there's not much of a problem with the radon in public water supplies. As long as it's coming from surface water, because once it's exposed to the air, the radon gas can dissipate into the air. If it's coming deep from underground, such as from an aquifer, you have to watch out. And that's, of course, where I suppose private wells get the water from also. They're also drawing on water out of our sole source aquifer. So it can accumulate gradually and wouldn't dissipate unless it's in contact with the air. So they have set limits for outdoor for radon concentration at 0.4 picocuries per liter of air. That's what you typically can find, but usually in homes it is often higher. And so it's been found in new and old homes. I can vouch for that. My home is brand new. And what I discovered when I was looking around is a pipe that went down into the basement floor. But it was open on top. It wasn't connected to anything. And then I looked up at the ceiling in the basement and I saw another pipe that was open at the bottom, but not connected to anything. So of course, I'm curious. So I called, the guy who was in charge of construction. I said, what is this? And he said, oh, well, that's just in case you need it, because the pipe actually goes into the ground below the foundation surface. And the pipe up above actually goes out through your attic, through the roof to the air.
Mhm.
And I said, well, how do I know whether or not that needs to be connected? He said, oh, that's entirely up to you, and he walks away. And so within an hour, was over at the home store looking for radon detection kits, which I found, and they're not expensive. And so you can buy those and you actually set them up on a little platform, maybe a foot above the basement floor,
Mhm.
and you just leave it there for anywhere from 24 to 96 hours. You take out the little carbon filters and you send it in with an envelope they'll give you to the laboratory.
Mhm.
And within 24 to 48 hours, they send you a reading. And if it's above 4, it's considered hazardous. And so I, of course, called the contractor and I said, you gotta connect that up.
What was yours at?
Hmm?
What was it at?
I believe it was at 8. And I tested it twice to make sure.
Yeah,
And I said, this has to be taken care of. And I watched what they did. They connected the 2 pipes together, and then way up in the attic above the garage, they installed a circulation like fan
Mhm.
that actually pumps the air through the system
Mhm.
from underneath your foundation out to the air, which apparently decreases the pressure and allows
Mhm.
the radon gas not to accumulate in your home.
Mhm.
But it gets worse and worse and worse, and you've got to be very, very careful. So it enters the home in a variety of ways, and the next slide shows you how. So it can come in through the floor wall joints, crawl spaces, sump pits, floor drains, block wall foundations, utility lines that are penetrating the foundation, cracks and crevices in your floors and walls, and especially from dirt floors.
Mhm.
And so if you have a reading, it's coming in somehow. And you have to reduce the pressure underneath your foundation and vent it out into the air through the roof.
Mhm.
At least you were supposed to. I went upstairs and I looked, the contractor that was putting in the fan motor, which runs forever. And he showed me how to make sure it was still running. And he looked around and he said, you've got a problem with your attic. What's the problem? And he said, well, your bathroom fan vent isn't connected to an outdoor access. It's venting into your attic. And he said,
Mold.
well, he said, well, first of all, that's against code. And,
Wow.
and so at that point, I called the contractor and I said, guess what? Something else is wrong. And one of your subcontractors did not connect it to an outdoor vent. Oops. So you have to be aware of these kind of things. On the next slide, you'll see. Usually the majority is going to come up from the ground. As a result, concentrations are highest in the lowest levels of your home, as in for those of us who have basements, your basement,
Mhm.
which commonly is where if a guy has like some kind of den area. Or sometimes they call it a guy escape.
Yeah, okay.
Right, you just ain't down in the basement, you spend a lot of time. And that's probably a problem. So private wells need to be tested for this. I don't know if we have private testing requirements for radon for private wells. We should probably institute them. Simply because it's not expensive.
Mhm.
It is a little more expensive to test water than it is to test air. But there is a kit you can buy that will allow you to test the water coming out of your well. And I don't think you would probably want to be utilizing water out of a private well that has radon in it. But anyway, we can discuss that as a committee later on. So well water is a source of radon exposure, which I didn't know. I thought it was just something in the air in the basement, but it's not. The next slide. You see, is it harmful? Well, yeah. It's a carcinogen that causes cancer. In addition to how it causes cancer, directly, there's an indirect way. So it decays into something called radon daughters. I don't know why they called it daughters. It could have been sons. I want to be correct.
Children.
So-
Gender neutral.
So these things, they're solids, they're not gases. They stick to surfaces, including dust particles. And the dust particles carry radon, children, and can move with the air, and you breathe them in. When they get into the airways in your lung, they of course break down further. They release bursts of energy, which damages lung tissue, causes mutations, damages cells within the lungs, and can cause them to be developed into lung cancer. And it develops, like all radiation, the risk is additive and cumulative. And so the longer you're exposed, the more risk there is. And they found out now that radon is the leading cause of lung cancer in people who never smoke. Hopefully that's all of us. And the second leading cause of lung cancer overall. So this is no, sort of, this doesn't happen. What does happen, it happens to lots and lots of people. The next slide. You just see some statistics. They've estimated that 21,000 radon-related deaths occur annually in the United States. That's a lot of people that are unnecessarily dying, and public health is all about preventative care. And so we have to make people aware of this. It's more deaths than come about from motor vehicle accidents, falls, drownings, and fires combined. So what does this mean? There have been 628 radon-related lung cancers annually occurring in Massachusetts. In Massachusetts, 650,000 homes have radon levels exceeding the action level of 4 picocuries per liter. And 34,000 homes in Massachusetts have radon levels exceeding 20 picocuries per liter, which is extremely hazardous. So air testing is required, and if you have a private well, so is water testing. And 1 out of 4 homes that get tested have radon levels that are in the action range where you have to do something about it. The next slide shows you one typical radon test box that you can buy online or you can buy it at home stores. It costs $32 or so. And it might save your life. So it's worth having. It's pretty simple to do. And if it turns out to be a higher level than 4, you're supposed to test it a second time to be sure. I did. Mine was also elevated the second time. So the next slide shows you a different one. This is the one you use for water. So if you have a private well, you use this kind of thing. The other one, actually, the cost included the lab test. This one, they charge you separately for the lab test. And it's either $30 or $40 to get the lab results back. The next slide.
Most home inspectors, Barry, will also do this as part of your
Yeah.
home inspection if you're buying properties.
Now they do.
And it's worth it.
Yeah, absolutely. And if you get a home inspection done and they didn't do it, you should insist on it before you purchase the property.
Yeah.
And of course, then the homeowner would have to remediate it before the purchase could go through.
Right.
And, obviously, most banks, if there's an issue like this, they probably wouldn't even give a mortgage until it was corrected. Same thing is true for other
18
things.
years when we moved to Plymouth, when we sold our house, we had to have this done. We had to have a radon test done.
So that's required by state law now. Because it's a silent threat. But if you look at the next slide, I think it's in the next slide. That's the source of radiation exposures in the United States. that box over in the lower right is radon. And so it's a big source of radiation exposure. The next one after that is medical procedures.
So Barry, I have a so it is required to have radon testing when you're buying.
When you sell them.
When you sell the house.
It's a seller's responsibility.
It's a seller's response. So when you were buying your house, it was new construction.
Yes,
Was it required?
I don't think.
No.
You don't think it's required?
Well, maybe Norton required it.
It might have been the town.
Yeah, maybe it's
Okay.
hard, because it was
Okay.
required.
Okay,
I know,
well, you
yeah.
were selling your house, but when you
Yeah.
moved to Plymouth, do you remember a radon test being done?
I don't.
That's how I feel, like, I don't remember, and it's really, I just don't remember, like, I
Yeah.
wasn't paying very.
But I
much
remember,
attention.
because I remember the girl said to sell the house, and then, my real estate agent called, and she's like, I think she did say Norton requires a radon test.
Yeah,
I was like,
Yeah.
what?
because I just sold my house, my first house. And, we didn't have to.
Okay, all right.
It must be the town.
We did do a test, when we bought our first house, and I have a great mitigation system and I knew about something, so. We didn't do the second test, so.
In the new house, you did the testing, or you put in,
No,
they did?
I did it the first time we bought a house, the second house, they already had a
Oh.
mitigation system.
All right, perfect.
so I don't know how many people sitting here or online have actually tested the house for radon. But everybody should.
I know at least one.
Oh, yeah. Yeah, you have to understand that I got a folder that was like that thick about all the things that were in the warranty for the house. I read the whole thing.
Yeah,
And I highlighted it.
I do that.
But most people would be so intimidated by a thing that's hundreds of pages long.
I read my insurance policies. No one does that either, but I do.
They would just.
Do you read like the disclaimers that you have to check at
I
the bottom?
do. Yeah, I'll never sign anything right away, I was sure you give me a chance to read it. I don't know why.
It's all, you should.
It's,
yeah.
I've always done it.
I know, I wanna be more like that.
So the first things I thought about when I saw this was, well, first of all, that doesn't seem to relate anything having to do with exposure from radiation being released from the nuclear power plant.
Yeah,
But then I remembered the guy who's on the epidemiology department at Harvard that's doing some testing, is actually collecting dust samples
Yeah, yeah.
from the homes.
Mm-hmm,
And that explained why. I said, why dust?
mm-hmm.
But obviously, there's a bunch of things that can produce solid radioactive materials that can bind to dust.
Right.
And so that must be what he's doing it for. The next slide. Everything else I'm gonna do is much shorter. So can you fix it? Yeah, we already talked about that. And then down the bottom, I underlined it. At the present time, Massachusetts, the state, the Commonwealth, does not have any regulations in place to protect owners of existing homes from radon exposure. That's why it's important to test your home and take mitigation steps if your home is found to contain elevated levels. So I'd be willing to bet you that if we took a poll of the people living in Plymouth, 90% of it would probably not have tested their homes for radon or even know what radon is. So how do we get the word out there? I don't know. You can put it on the department website and warn people that, radon has been found in homes in Plymouth. And what's strange is I, of course, mentioned this to everybody on the street. That, oh, here it comes again. Now, what? And I spoke about radon and they said, oh, I was wondering about that, but I didn't know what it was and I just ignored it. So several people tested and one person living immediately next to me was low enough so he didn't have to do anything. And two people across the street had high radon levels.
Interesting.
And then there was speculation that it not only having to do with the natural soil and rocks under your home, but when they build the home, they bring stuff in to put it under the foundation. And depending on where they got it from, it could be something that has higher than normal levels of uranium that breaks down into radon. So anyway, bottom line is test. Next slide. And this links where you can get more information. And you notice it is the Mass Department of Public Health, the Bureau of Climate and Environmental Health, Indoor Air Quality and Radon Program. So they have a program, but they don't have any regulations, which I don't understand.
No, there's no federal regulations either,
No,
so.
and so, kudos to the towns that make people
know.
test. Next one. The rest of this is much faster, the next one after that. Oh, it's on virus disease. So this is another thing related to all tick-borne diseases. As you can see, it's a virus-caused disease, unlike Lyme. So Lyme disease is actually transmitted by ticks, just like Powassan disease is, but there's a difference. This is a virus. Lyme disease caused by bacteria. You can treat Lyme with antibiotics. There is no antibiotic for virus-caused diseases. So there are different organisms. Lyme disease is much more prevalent. We get cases all the time. There's 30,000 Lyme cases annually according to the CDC. And there's far less Powassan cases, but it's a much more dangerous disease. In the past 20 years, they found as few as a single case in the US, up to 44 in 2022, but it's increasing. And so you have to be aware of it. And the next slide will show you the symptoms. I think some of these are the same as Lyme. Fever, headache, vomiting, and weakness. But Powassan can also cause confusion, loss of coordination, difficulty speaking, seizures, encephalitis, and meningitis. And when you start getting into encephalitis and meningitis, you possibly could die from it. So you have to be careful from that perspective.
There was just a case in Sharon.
Yeah, that's on the next slide.
Sorry, I jumped ahead.
Next slide shows you what happened recently in Sharon. So they very recently confirmed that they had a case of this in Sharon. It was posted on April 25th. I don't know if that gets posted on Maven or not. You know?
It would, but only for Sharon.
I know, but I mean,
Yeah,
that is a reportable
Yeah,
disease, I'm
yeah.
sure. And so is Lyme, I would imagine, right?
Yeah.
So Sharon is part of the shared services network so it went out to all the towns that are around Sharon, just from public health sharing.
right, but the person
The person, we know,
in Maven would only be
Yes,
accessible.
yes, and if Sharon didn't reach out and say, hey, guys,
Right.
guess what?
Right,
Then it wouldn't have been such a concerted effort in a
Right.
regional area versus
Right.
just one town.
and it was discussed too on our, I don't know if you're on the
Yeah,
The-
yeah.
state call.
Yeah, so, it's good to know about it.
Yeah,
Unfortunately, the only ways to avoid it are to lessen your exposure, possible exposures, to do exactly what you do, avoid any tick-borne disease.
Yep.
Wear long pants, wear long sleeves, avoid areas that have high grass or shrubs. And you're better off on paved or at least dirt trails where there isn't any high grass or shrubs. Obviously, dogs can also pick up the ticks that cause it. And so you have to check your dogs when you bring them in to make sure they're not carrying along a hitchhiker.
yeah, little travelers,
Yeah.
yeah.
Mine usually are. Have you heard of I forget what town it was. They have I'm sure there's several of them, but they have a dummy and they dress it tick safe, and then they take.
Ah,
So our region is doing that. We're getting dummies and then we'll dress them tick safe and then put them like in the library with some posters and some information. I know what you're supposed to do, but I kind of pretend I don't. So if I saw it more like, tucking your socks in and long sleeves and.
Yeah, now
That
you're
kind of
saying like
stuff.
tuck them in, but then wrap them in duct tape.
Oh, gosh, wow, yeah.
Yeah, so they actually get all stuck,
Yeah,
and then you just pull the
Yeah.
duct tape off. and-
yeah, with like the ticks all, who was just telling me black flies, like something putting, like some sticky tape that attracts the black flies to the back of a hat, and then they come and get them. But
Oh.
I know, it sounds very similar.
Oh.
Yeah,
Black
Sorry.
flies, they have that
Oh, yeah.
worse though.
yeah,
Yeah, if you ever go to the beach, in a lot of the areas around here.
I was.
And the wind is coming off of the ground, off of the land, not off of the water. You get bitten by these things. And they hurt. I mean, they really hurt.
I was at a perk test recently and there were black flies and I was there for an hour and what I didn't realize when I came back, the admin said my whole neck, there were 20 bites, like here down, just red
Ooh.
black fly. It was nasty. I have a picture of him. but it
You
was-
must have felt them. I mean, they
I felt them,
hurt.
but I didn't, it took me a while to feel the itch of the bite, but it was disgusting. So
I've been
sorry.
chased off of
Yeah.
the beach more than once by swarms of those things.
Yeah,
They also seem to like to get into the wet seaweed piles.
yeah.
So you have to watch out for that. The good thing about chick or vector-borne diseases, as Devon knows, they're not transmissible from one person to another. So you don't have to avoid contact with somebody that has these things, because you're not gonna catch it from them. It's only transmissible by the insects. Next line. And the one after that goes on to the next topic. This has changed, so what I routinely do is I scan for at least a week before the meeting all the news releases that have anything to do with public health. And if something new comes up, it's usually not just on one release, it's usually on several. So this is a new breast cancer screening guideline, and it comes, all I had was the abbreviation, and I looked at it, I said, what on earth is USPSTF? So I looked it up. And I didn't even know they existed. United States Preventative Services Task Force.
Oh, there you go.
Oh, I like it.
And now the new guidance for mammograms is every other year from the ages 40 through 74. There is still debate about whether or not, as you can see further down there, is whether or not they should continue screening after age 75. And in some cases, you run into insurance problems because they don't want to pay except once every 2 years, and they only want to pay in the age group for which it's been recommended. And if you try to get tested outside of that, permitted group, you probably end up having a fight to get them paid for it. So there's more research going on all the time. There's trouble apparently with some women need extra testing because they have particularly dense breast tissue. And apparently in mammograms, that reduces the chance of seeing any kind of malignancy that's developed. And so there's debate about whether or not ultrasounds or MRIs would work better. So that's an ongoing sort of thing. This relates also to the general trend of they're finding cancer more and more among younger people. Even though the cancer rate among older people has pretty much gone flat or is actually decreasing somewhat. And now there's debate going on, and this again goes into epidemiology. Why?
Yeah,
Especially colon cancer is a big issue apparently with younger people.
huge uptick.
And it's very concerning, and there's debate about, well, is this because there's more exposure to environmental hazardous chemicals than there used to be? Maybe, but you don't know until you actually do some kind of control test. Is it because people are spending more time just in sedentary activities? And they're not active? Is it because people's diets have changed? The bottom line is nobody knows. And it's kind of a hard design research project to set up, I think. Because how do you do it?
Yeah.
Gonna interrogate everybody to find out, what they've eaten. Do they know what chemicals they might have been exposed to? Probably not. Is it clustered in a certain area? Is it worse in some areas than others? I don't know. Maybe you would know, Devin.
Yeah, I haven't looked super closely at that topic, but I mean, we still don't know and probably won't know for years and years until we can, like you said, do these long-term studies and say, okay, people who lived in Plymouth during 2024 to 2030 were X times more likely to, so it's gonna take a lot of time, but you're right. But people should know to screen earlier, even if we don't know why, we should always.
I think mammograms used to be paid for on an annual basis. Didn't it? And then they changed it. Why did they change it?
Wow, I actually get the main phone call.
Yeah,
You're way overdue. Okay, great, I'll set that up.
Another problem with the mammograms is access. Get in to get the test done, and that's what we find is a a big issue. And lower in age, it's gonna be even more people trying to get the
Mhm.
mammogram, so just thought I'd throw that in there.
Yeah.
Interesting.
And you should know that it's not just necessarily for women,
Mm.
Yeah,
because men can get breast
I
cancer
have
too.
I have a cousin that's a man that has breast cancer.
Mm.
And so most guys just ignore that, think, well, that only happens to women, not true. It happens much more often in women, yes. And there is a positive correlation, I believe also, with people that have, that are really vastly overweight. Obesity, I think, does have some positive correlation with the risk of breast cancer.
Mhm.
And then, of course, it's genetic.
Yeah.
That's, everybody probably knows or heard of BRCA1 and BRCA2.
Mhm.
If breast cancer runs in your family, you probably should be tested to see if you have a mutated version of either of those two genes, because if you do, the chance of getting breast cancer eventually is probably at least 50%. And that's pretty bad odds.
Mm.
And so some people who have found out that multiple people in their family have gotten breast cancer and they've got BRCA1 or 2 mutations, they actually decide, if they're already finished with having the family, that they're just gonna have a bilateral mastectomy done.
Yeah, Angelina Jolie. That's one.
She's definitely very vocal about it.
Absolutely.
Yeah.
Then helps spread the word.
Yep.
Yeah.
Well, that's new information also. I think the next slide goes on to the next thing. Yeah, that's my spacer slide. So methylene chloride.
Yeah.
I got really concerned when I saw this, because I remember stripping paint. I had an older home in New Jersey. It was built, I think, in like 1912 or something like that. And I got a little worried about the paint, because obviously it was leaded paint. And we wanted to repaint, and so you had to remove the paint. Well, you can scrape it off and chip it off to some extent, but it's usually pretty difficult to do, especially if you've got multiple layers. And so what do? Well, you buy a paint remover. And this is the stuff that you just sort of paint onto the paint, and then the paint sort of bubbles up. And then you can take scrapers and you can remove it. A lot of this stuff contains methylene chloride. It's a dangerous chemical, they now know, causes lung cancer, liver cancer, lung cancer, breast cancer, brain cancer, cancer of the blood, and cancer of the central nervous system, neurotoxicity, liver harm, and possibly death. So it is big time bad news. And the consumer use is being phased out within a year. Most industrial commercial uses will be prohibited after about 2 years, but that stuff is used in more than just paint remover. They use it for making climate-friendly coolants for your refrigerators, because you can't use Freon anymore. Battery separators for electric vehicles. It's also been used by consumers, and it had, I can tell you by firsthand knowledge, it had kind of a sweet smell. I don't know why, but I distinctly remember smelling it when I was working with it. It's also used for degreasing paint and coating brush cleaners. In commercial applications like adhesives and sealants. It's used for making other chemicals. And at least 88 people in 1980 died from acute exposure to methylene chloride, mostly people working in debris finishing, paint stripping, and in some cases, even though they were trained in wearing personal protective equipment. So nasty stuff, and that came partly out of an article in Washington Post by Maxine Joselon. The next slide shows you something that also bothers me a lot. So way down at the bottom, methylene chloride is also used to make decaffeinated coffee and tea.
That's fun.
Yeah, lots of fun. And so I looked up decaffeinating procedures, and it listed 2 methods really. One is water-based and the other is chemical-based. So this is the chemical one. If you get decaffeinated coffee from Starbucks, it is chemically decaffeinated. If you get it from Dunkin' Donuts, or you buy some other brands like Pete's.
Mhm.
And I believe, there's one other one, that I looked up and it was also made by a water-based decaffeinating process. So
Hmm.
what they do is they take the coffee beans and they soak them in water. That extracts from the coffee beans, a lot of the flavor.
Mm.
And just about most all of the caffeine goes into the water. And so, then they try to run it through a filter, which removes only the caffeine. But leaves all the flavoring agents from the coffee, and then they use that, put it back in with the coffee beans that have been already treated. And so they put one back in and they remove the other one completely, or almost completely. If you go out to Seattle and you ask for decaf coffee, they look at you funny.
Oh, yeah.
So there is no such thing as
Is that
decaf.
thing?
There is low cap.
Yeah, yeah.
Because it's not ever completely removed. But you know, it's an issue, and I don't know what other coffee brands are chemically decaffeinated and which ones aren't. But it's a problem. EPA is excluding the uses. So there's restrictions on methylene chloride. But unfortunately, they can't restrict it in the food industry, in pesticides and in pharmaceuticals. In some cases, those are also used, but that's up to the EPA, up to the FDA mostly, if it involves those kinds of products. So the EPA can't do it. And so, if they can't do it, like US Food and Drug Administration and the FDA has to. So, that stuff could cause at least 6 types of cancer and all kinds of other problems. And unless additional restrictions are put in, there's 260 million pounds of this stuff in use in this country every year. A whole bunches of it. And that's all of my lecture material for today. I was joking with David. On the way out, David said, "Don't you miss teaching?" I said, "Yes, I sure do." But I still do some, but the audience is changed.
Absolutely. Still teaching.
So unless anybody has any questions about any of this, Lorenzo, did you see anything that brought up questions in your mind?
No questions. A comment on the coffee. We've been using water-based decaffeinated coffee. Speedwell, the Plymouth coffee roasters exclusively do that. And some of the smaller craft batches, like on the Cape, like Snowy Owl, Three Fins, they're decaffeinated, is all water-based. And you could absolutely pick it up at Whole Foods. You just look at the label and it'll say water processed.
Yeah, I think Newman Organic also is water processed.
And with the radon piece, I did do a test recently based on your topic of radon a couple months ago. I think you might have said it, and we went and bought a kit and did it, and thankfully it came up negative, came back. So very simple, easy. Pick up the kits in your hardware store, you know, Ace Hardware, local, or big box, Lowe's, etc.
And they all have it. You can get it at Lowe's, you can get it at Home Depot, you can get it from Ace. They're easily accessible. You don't have to order them online. Unless you want to.
Yeah, it had a peace of mind. So
Yeah,
move
but
on
that's
for
just,
other things. Ticks.
that's just the airborne, right? Do
Yeah.
you have a private well? You have a private well, do you, or do you?
I do not have a private well.
Yeah. Wonder how many, well, we know how many people in Plymouth have a private well.
Well, yes and no. Yes, we could get an estimate by subtracting the number of people who are on town water. And
And how many households?
that number, yeah.
Yeah.
But often when we have septic variance requests, it turns out they also have a private well.
Mhm. Yeah, but it's interesting. I have septic and I'm on town water.
I'm the same.
Yeah, it's different.
So it does happen, but
Yeah.
I don't,
I'd rather have it that way. I'd rather
Yeah,
have
well-
my water come in and deal with my waste going out to my backyard than my water coming in from my backyard.
personal preference.
Personal preference.
Oh.
You have private, both, you have.
No,
oh,
I said we need to stop doing both
Yeah.
in this town.
Yeah,
Yeah.
yeah.
So my feeling was that, it's gonna be expensive to require private well owners to test for PFAS,
Mhm.
because that's very expensive, that test.
Mm.
But apparently it's not so expensive to test for radon.
No, and there are a couple of, agencies recommended by the state who will come, collect it and stuff too, so. But again, there's no standard,
For radon or PFAS?
Yeah, and, radon in the water.
Cause it's only so the 4 is the air,
Yeah.
but there's nothing in the,
You know,
oh.
there's recommendations, but there's no standard. So,
I mean, the standard is.
you don't want it.
If you have something that's detectable
Yeah.
and it's in what you think is a significant level, you don't want it.
Mhm.
So, that takes care of that. I'm done except for, one announcement on the chairperson's announcement. So Karen, could you go ahead with? your
Sure.
report?
I wanna go into a little bit more detail about ticks, actually. Probably for the next few directors' reports, I'm gonna have different things about ticks, because it's just so important that we continue to say this over and over again, so people in the audience and on looking at the websites and social media can see what some of the suggestions are. And again, one of the most important things you can do is to check yourself and also your family members. You've heard places that ticks like to go on the body include the area between toes, back of the knees, groin, armpits, neck, along the hairline and behind the ears. And just like Dr. Poppin said, remember to check your children and pets. Remove any attached ticks as soon as possible. Ticks are tiny, so they always recommend that you look for any new freckles that you may have not noticed before. If you find a tick attached to your skin, don't panic. Use a pair of fine point tweezers to grip the tick as close to the skin as possible and pull straight out with steady pressure. No one's recommending anymore. I don't think we should do this. They would apply kerosene, nail polish, use a hot match.
Yep.
They're not effective and they actually may result in causing even more injury.
Have you guys ever heard of tick pickers? Like you buy them and they.
Yeah, yeah.
Those I think are
Yeah.
worth the money, if you're dealing with a lot of ticks, they're.
Yeah, well, it gets a little feet too, make sure that all the little feet get pulled up.
Mhm.
Circle the calendar date and note where on your body the tick was removed, because you may want to save the tick for identification. Your physician may choose to treat you following a deer tick bite and notify your healthcare provider if you've been bitten by a deer tick, or if you develop a rash or other signs of illness following a tick bite. So when going outside to an area that but likely to have ticks, and I'm just gonna say, let's just say all areas are going to have ticks. Stick to main pathways and the center of trails when hiking. Wear a light colored long sleeve shirt with long pants. Like we said, tuck your pants into your socks. Again, we recognize this may be difficult to do as the weather gets hotter, but it will still help keep ticks away from your skin, and it makes it easier to spot a tick on your clothing. And then it does, go on to say that, you can use bug repellents. Always follow product instruction, for the amount of DEET for adults and also for children, and never use insect repellents on infants. And then you can always talk to your veterinarian about the best ways to protect your pets and livestock.
That permethrin stuff is not made to be put on your skin.
Mhm. That's for clothes only.
That's for clothes.
Yeah, that can be used on your clothes, yep. Yeah, that's what it says, a product that can be used only on your clothes. The next thing is that, I don't know if you guys saw this, but that was important. The Public Health Council, to the state of Massachusetts sent a letter dated April 17th, 2024. And it says, dear esteemed public health workers and local Board of Health members, that would be you. We, the members of the Massachusetts Public Health Council, want to extend our deepest gratitude and respect for the exceptional service you have provided to our communities in Massachusetts. Your unwavering commitment to public health stands as a beacon of hope and resilience for all of us. The array of public health issues you contend with is vast, from the opioid crisis to emerging diseases to managing the care of new immigrants. Your routine tasks such as restaurant inspections, emergency preparedness, and fostering collaborations across jurisdictions are fundamental to the health and safety of our communities. Alongside these responsibilities, you are still managing the ever-changing complications of COVID. Your dedication to these duties is truly inspiring. We wish to acknowledge the immense contributions you make every day to the health and well-being of Massachusetts. The difference you make in the lives of those you serve is profound, and for that we are eternally grateful. Thank you for your steadfast dedication and for everything you do for the people of Massachusetts. Please know that your efforts are recognized, valued, and deeply appreciated. And that's with heartfelt thanks from Commissioner Robert Goldstein and members of the Public Health Council. So I just thought it was important that we actually read that into the record, because it's nice to every now and then get a little way to go. Because a lot of times that we do deal with all of these issues, you know what I mean? And we're doing it to help our residents and our visitors, but sometimes we don't perhaps get the positive responses that we hope. But it's nice to, you know, people are recognizing the great work that, especially here in Plymouth, I think that the board and the department, I think we do great collaboration for our residents. So I thought that was important to share.
I want to point out that that also says public health workers.
Yeah,
So that's the department.
Yeah. yeah, absolutely. That's what I said. We here in Plymouth are, I think our residents just are, the benefit of having us work so closely together is just so great. You know what I mean? That we have a board and a department that works so great together, really, because it just benefits our residents, and I think it's fantastic. And then I just wanted to remind everyone that we are now in May, and it is Mental Health Month. And that green is the color for the month of May, so anytime that we can get some green out there. Oh, Dr. Parkman, very good, very good. We'll have to keep our eye on and green, and just remember that it is Mental Health Month. And that's all I have for tonight.
Okay, thank you, Karen. Does anyone have any other questions, comments for Karen or the department members?
I have one. I know Lorenzo had sent out an email about the article having, or he was asking if there was a Plymouth Board of Health report about the water.
Mhm.
Did you have that? Did you get that?
There is one that someone sent me, but it predated my residency in Massachusetts.
Oh, geez.
So it went back to like, I don't know,
Wait a minute,
2016.
so our water quality report for Plymouth?
No, it was something having to do with the Board of Health responsibility for overseeing water quality.
I know. Lorenzo, do you want to speak to that?
Well, you don't, so.
Oh. Oh, wait, you don't. I was like, he doesn't? I
No,
thought you
no, no,
said-
no.
Like,
No,
what?
because in Plymouth, we have a water superintendent.
Yes, yes.
Right, so the water superintendent, that's part of what their
Yes.
responsibility is, but we do have a brand new report, that's why I thought they'd be.
Yeah, I do. Lorenzo, do you want to speak to that?
Yeah, no, I just sent, I was gonna look for the email, but if you come back to me. I mean, otherwise we can table it for the next time.
Yeah, it was an article in the Independent about referring to,
Yes. I sent
Yeah,
that.
I got a call from them about that. They want to know what the Board of Health Department was doing about water issues in the town of Plymouth. And I said, well, we're not really responsible for overseeing the water supply in terms of, do we have enough water? If it's being drained off too fast, that's other groups in Plymouth that follow that.
Yeah, I actually answered Lorenzo,
Yeah.
what it was is in 2014. A report was issued by the Massachusetts Association of Health Boards.
oh,
It was not issued by
Okay.
Plymouth.
Mhm.
So the Plymouth Independent should have clarified that a little
that
bit
makes
more,
sense. Okay,
yeah.
that makes
yeah.
total sense.
Yeah,
I
so the
was just-
report's from 2014,
Well-
and it was issued by MHAB,
Okay,
yeah.
thank you very much
Yeah.
for that
And
clarification.
do we care about water quality? Yeah.
Well,
Oh, yeah.
I mean, in understanding the role and responsibility of health departments compared to, you know, towns that are set up where, although within the law, it might fall under the Board of Health or the health department, working in partnership with other departments that oversee it is very different than saying, here's a Board of Health a report
Right,
that
yeah.
that wasn't even written by the Plymouth Board of Health.
I mean, are we
And
concerned
it's 10
about,
years old.
about nitrogen? Are we concerned about PFAS and radon?
Yeah.
Yeah, sure, that's public health.
Of course,
Mhm.
of course.
Mhm.
Okay, oh, Lorenzo had his hand up, sorry.
Yeah, no, now that Karen did respond to me directly, but to bring it out in this forum, you know, that article had 4 things that residents can get involved with in drinking water protection. And the
Mhm.
3rd thing was read this report published by the Plymouth Board of Health. And long story short, the Plymouth Independent was incorrect in reporting that because it was not a report published by the Plymouth Board of Health, but instead MHAP. So that just put that together. I don't know if we send them a letter at the Independent to have them correct themselves, or do we just leave this alone and just go from there? But the article did ask people to do 4 things, and that was one of them. And I said, what? I don't even know about that report, and it's incorrect.
Yes, what we could do is we could encourage the Plymouth Independent perhaps to publish the new water report, you know, for the town of Plymouth.
Well, when Lorenzo was saying, should we tell them, have you gotten any calls about it other than Lorenzo saying, so, I don't know if anybody's paying attention.
Right. So to me, it's like, does a tree fall with no one?
Yeah.
I mean, we could get people to pay closer attention if we made them say, you know, if somebody realizes that they're misreporting something, then it'll get more attention than if you report the.
Or if they read luckily, the report is very good, but let's say it wasn't.
Yeah,
Do you know what I mean? Then I think we'd probably have more residents reaching out to the department to say, well, what are you gonna do about this, you know?
yeah,
But luckily, the report was a good report.
okay. Right. Thank you very much for all of that.
Yeah, so I don't know if I should I contact the guy that, don't bother.
That'll just be probably one of many items that will be a little, as they become more familiar with how there's a board, there's a department, there's a state, you know what I mean? Once they start becoming more familiar with that, I think they're learning. So,
It is a complicated system.
yeah, it really is.
It really is.
Yeah, so I can understand why, you know what I mean, like, there's a state department of public health, there's a board of health, there's a health division, which is part of Health and Human Services, so that's.
Well, then you
It's a
even
lot.
say, you're talking about MAHB, MHOA,
Yeah.
MEAH,
There's
you
a
know,
lot of
like,
players,
yeah.
There's a lot of players on the team,
Oh,
so
yeah.
we just have to,
And it's all alphabet soup.
Yeah.
but we're all trying to do the same thing, so we're keeping our eye on the prize.
So anyway, the only announcements I wanted to make, I already got a call from the woman who's the reporter for the local radio station.
Oh, WATD?
Yep. She wanted to know about plastic people. And I said, well, that is an announcement about something that's going to happen on Monday, the 13th of May at 7 o'clock in the Plymouth Library.
Mm.
That is a film. It's called We Are All Plastic People Now. And it's about basically microplastics, which we have all ingested and probably have some at least inside of us. It causes a lot of harm to other organisms too. So I was recruited to go to that and to be there to bring up health risks from microplastics at the conclusion of the film.
Oh, that's good.
So of course I will do it. I said, well, how much do you want me to scare people?
Do it with a smile.
Yeah, well, everybody should know the risks that you suffer from.
Yeah.
And I didn't even know this, but you get microplastics, if you have a plastic bottle with a plastic screw cap, as you unscrew it, it actually causes microplastics to get into the water. And so that's pretty hazardous. Also, they claim you should never store plastic bottles of water in your car for long periods of time, especially in the heat.
Yeah.
Because all sorts of things come out of the plastic and get into the water, which you then consume. So there's a lot of worries about plastics. And there's some pretty horrifying scenes you can see online about the amount of plastics that are floating around in the oceans. Which is really bothersome. The only other thing, of course, is to definitely express my deepest gratitude to David Gold
Yes,
Yes.
yes.
for his service, which is shorter than I anticipated.
Yeah.
But you've been an invaluable member of our board of health, David.
Yes.
Thank you.
So
And-
true, so true.
And especially to me, because you were so focused on detail.
I know.
Yeah.
Learned a lot.
Yep, so I learned from you, and I hope you've learned a lot more about public health than you ever thought in your life you would ever know.
So, yeah, thank you, Barry. It's been a pleasure serving with both of you folks.
We will certainly miss you. And of course, you are, as I said before, welcome at our Board of Health meetings every time. You decide you want to come.
Appreciate that.
And perhaps the select board can make it official by saying that you are going to be their representative to the Board of Health.
I'll definitely be around.
We'll definitely be seeing David, just in your capacity.
And I know how to find you. So I'm gonna need another parliamentarian. I guess that's gonna fall on you, Karen, in the absence of Davis. But we all do our best. So that's basically, we wish we could have like parties, but we've been through this many times. Every
Yes.
time somebody leaves the Board of Health,
Yes.
we wanna do something. And then we find out, well, actually, if you're gonna have a quorum present,
Yeah, we can't talk.
you can't talk about anything that has to do with anything that might come up before the Board of Health.
Public
Okay.
health is everywhere, so
How's your daughter doing?
she wants to go into public health.
Can't talk about that.
Charlie wants to be a paleontologist.
Yeah.
Oh.
Really?
Or an animal doctor, or
Oh,
Yeah.
there's a
How old is
really,
she?
5.
there's a big shortage of veterinarians.
Yeah, yeah. We have a cousin who's a vet, and she is obsessed with his work, so.
That's incredible. That's great.
And she spent a lot of time at the vet. Do you have pets?
We know, we lost a dog last year.
Oh, yeah, that's a tough thing to go through. Anyway, once again, I'm sure, Deb and Lorenzo will join us who are present in person in wishing you all the best.
Thank you.
Absolutely,
And
yeah.
try to make sure that you probably know already, but you've got to have a life outside of all the stuff you're doing for the time.
That's right.
You got it.
Don't forget about public health too.
Yeah.
Your new role.
As a matter of fact, sometime in June, I fully expect that both Amy and I will be coming before the select board.
I'll see you there.
I
Yes.
I know. So
don't know if you have to recruit yourself from voting on the two of us, because you know us
I
personally,
don't.
Yeah, he does not. No.
but you will see us in person there, right, Amy?
Yep, I
Okay.
already signed up. I remembered last time. Yeah.
I'm still working on, it said, list your accomplishments.
Oh.
Is that in this box?
Well, a few of them, but it's the highlight reel.
So you gotta figure out what was the most important things you accomplished over the past 5 years, in my case,
Yeah.
6 years. That's not possible. I can't do that. I could send an addendum.
Remember that, the select board has to read it.
I know, but I assume they do look at the things you fill out online, and they prefer that be done. As a
Mhm.
matter of fact, they prefer that anybody
And
apply
they
for
should
any volunteer position,
Person.
Yeah,
fill out an
Okay.
application form,
right.
which has very specific questions on it.
Mhm.
And I guess it does not speak well in your favor if you fail to do so. And probably not so good if you fail to show up in person if you're expected to be there.
Yes.
Yeah, that is a.
That is annoying.
important. Yeah, yeah.
So anyway, Amy and I will be asking to be reappointed, but that means we have,
Yep. Hopefully one person on our side.
well, it also means we'll have one of our full
Yeah.
members missing permanently from the Board of Health. And so, Deb, if you are interested in assuming that position, please send a letter into, I guess it goes into the town manager's office.
I don't know,
Uh,
those are tough shoes to fill.
Thank you.
Well-
So I think what would happen is, we will advertise for 2 3-year terms and then one unexpired term.
Mhm.
I think I was reappointed last year,
You were,
so,
so you've got 2 years to go.
so
Yeah.
one unexpired, 2
Yeah.
years.
Yeah, so it gets, so 2 would be 3 and 1 would be 2.
Right,
Mhm.
And so there may be other applicants, but certainly, I would think that, if someone asked my opinion and said, well, Deb applied for the full-time position, for the full membership position, I would say, well, Deb has been with us for quite some time and she knows exactly what we do and how we do it.
Mhm.
And she knows a lot about public health, and she's already serving as a nurse. We've always had nurses on our Board of Health, I think, as far as I can
That
remember.
is true. Even when we weren't quite as active or proactive, we did have a nurse.
Oh, cool.
Yeah,
Sometimes there was more than one.
yeah.
And so, it's much more difficult to keep staff with a physician. Because occasionally you can find physicians that are working part-time or semi-retired.
right.
But usually we had a physician, remember, he was a hospitalist
We had
at
2.
BID.
Don't we have one? Isn't Terry?
Yeah, but we had
He was
someone,
semi.
yeah, he came in person, I can't think of his name now. I worked with him on the tobacco regs to lower the number.
Yeah, he often showed up online wearing his
Yeah.
scrubs,
Yeah,
that just came in from the OR.
which is so funny because when I first started working in the public health department, 12 years ago or whatever, it was funeral directors. I don't know if you,
I was on with funeral directors.
with funeral
Yeah,
directors, yeah.
yeah. I was on from 2003 to 2007, no, 8. 2003 to 2008. I had to leave I left a year early because when I was appointed, I had no kids. And when I was 5 years in, I had one in a bucket, one on activity, like doing activity books. And I was like,
Yeah.
I'm out. I was not as effective as a board member as I wanted to be, so,
Yeah.
but it was 5 years from 2003 to 2008. And yes, it was Kathy Cartmel.
Yeah,
And then another, I forget, he was there for about a year, one other funeral director.
yeah, it's interesting to go
Yeah.
back. Sometimes when I do research on certain things, I'll go back and read like really old minutes and stuff,
Yeah.
and I'll be like, oh, that's kind of interesting
Yeah.
board set up there.
Yeah.
And Lauren, as we said before, graduating or not, doesn't matter to us. You are welcome to any Board of Health meeting. Because you also probably have now a pretty good grasp on what we do, how we do it, and how important some of the stuff is that's going on between the department and the Board of Health here in Plymouth. A lot of towns don't have a department.
Well, it's interesting to say that because also in my research, I sometimes will reach out to another town and I'm surprised how little they're open.
Mhm.
Do you know what I mean? Like, we're open, we are accessible the whole time this town hall is open. That's not the case for all health departments. It's interesting. It's very different.
Because they're understaffed or,
Some of the towns are just so small, they just don't,
yeah,
you know what I mean? Like, it's probably a cost savings measure even just to have a person just sit in an office and not do anything, you know what I mean? Just these are the specific hours. Come in when the person's here, get the business done. You know what I mean? I can get that. I mean, we certainly have enough here in Plymouth to keep us busy, all day long, but I can see some of these other smaller towns,
mhm,
may not have quite as much.
And as you know already from the Public Health Excellence Grant experience, most of the towns have underfunded their public health departments if they have one
Mm.
by a lot.
I feel like there's like 3 that are fully funded. It's like Brookline.
And probably Worcester, I would guess. No?
I don't know.
I mean, that's a big city. I don't know, like I said, I feel like Brookline is the one that's probably the most funded health department that I know of. Everybody else is cutting all over the place, so.
And it's just a coincidence that Brookline often takes the lead on all kinds of
It's-
public health
yeah,
regulations.
It's definitely true, the fact that the tobacco-free generation is a bylaw, like that alone shows the commitment to public health from that town.
Mhm.
Something we could consider, but it certainly is politically sensitive.
I find it exceptionally interesting.
Yeah.
Yeah,
we're
I've
talking-
actually been to research on how it, the history of how it happened in
Yeah.
Brookline too. And though we have, I don't know, I think they came to all of you as well, but we have received a couple of letters from merchant associations asking us not to consider that, but
There's,
It's an interesting
yeah,
concept.
it's on the list of MHOA summer topics
Mhm.
for like lunchtime webinars.
Yeah, it's-
Tobacco-free generation,
it's very interesting.
yeah,
My take is that if it happens, it would be better if it happens statewide. And I doubt that the state has reached the point where sometimes there's so many local boards and departments that adopt something like that, that eventually it becomes a majority, and then the state will move.
yeah, the state won't do
Yeah,
anything
21.
until then,
Yeah.
yeah, 21,
Mhm.
and, I mean, we were definitely moving towards that with, flavor, but then the state
Yeah,
jumped in.
yeah.
But then, even smoking in public places, that was a
Mhm.
local town by town
Mhm.
thing.
Yeah, and then really when it came in from the state, it really just addressed working
Yeah,
conditions.
and
stuff,
and
yeah.
working in a restaurant.
In a restaurant, yeah, that's really what it was, yeah.
Which is
Yeah,
true, I mean,
yeah.
that's exactly.
But in a way, that was almost like an indirect way to get smoking out of restaurants.
Exactly,
Because you didn't say it was for the benefit of the patrons. What you said was it was protecting the workers, so you could smoke near anyone who was working in the restaurant. Well, your patrons gotta be pretty close to where the
Yeah.
workers are,
Right.
so.
and then like we used to talk about in public, I mean, in private clubs. That's
Mhm.
people feel like that can be a choice,
Mhm.
you know, it's not open to the public,
Right,
but.
yeah.
So there, you know, if you choose to be part of that club and they're smoking, that's your choice.
The same thing happened with airlines. I think the banning of smoking on airlines
Well, for the workers.
originally came because of concern for the workers.
Yeah.
Who are on the airlines their entire
Yeah.
working
Yeah.
time.
Yeah. it's
Whereas
true.
someone who flies is on a plane for
Mhm.
some number of hours,
Mhm.
once in a while. And in restaurants, if you go in, you're a customer for maybe an hour or two,
Mhm.
and then you're gone, but they're still in there working it. So, you know, what's more important?
Mhm.
So, anyway, any new or old business aside from what we?
I have, just, with certain meetings, I'm wondering if we can kind of if we can discuss the possibility of maybe having one longer meeting a month rather than two shorter ones, just because it's hard to get out of work early.
Well, funny you should ask, because we already had a discussion about the first meeting in June,
Mhm,
because Margaret can't be here, Karen can't be here,
mhm,
and I will be in Europe.
mhm.
Don't look at the.
Yeah, I mean, but I'm just saying, like, moving forward, like, it is, I appreciate our meetings, it's just, it's like a 4 to 6 can be really hard to get here
Yeah.
twice a month. If we can do it once a month, you know, maybe do 4 to 7, or
Mhm.
that would be much more manageable for me. I know, I don't know how everybody else feels, but work can be
Amy, how about we look at that after we regroup?
perfect.
You
Sounds
You know what
good.
I mean? Cause then we
Yeah,
have,
I know the next,
Yeah.
we've got a little bit of.
yeah, I mean, we're gonna have one meeting, probably, cause June 11th, we're gonna cancel.
Mhm.
So we'll probably have one meeting before we do
June.
regroup. Do
Yeah.
you know what I mean?
Perfect.
And
And
then
then we'll
I
see
think with the
what-
new group, we can,
Figure
Yeah.
out a little bit better.
Yeah.
Okay, thank you very much. That's perfect.
Yeah, 2 weeks from today, there will be a meeting, and we also
Yes.
have the public
Yep.
forum coming up.
yes,
You know, it's again, it's a time.
Yeah,
Right, but the public forum is at night,
yeah.
6:30,
evening hours.
Is that
What-
on the?
23rd.
Yes,
23rd.
there we go.
So what happened when I first joined the Board of Health, now almost 6 years ago, was that the meetings were actually split up, whereas one meeting was during the day, and the other meeting
Yeah,
was in the evening.
Yeah, that's.
And the one reason why it's a little bit of a concern for me, and I guess Karen can speak to this, is it would obviously delay any kind of variance request.
Yeah, and I definitely recognize that, and I would rather, in that point, if there was, if we had to have a meeting, we could add an extra one, rather than have a standing meeting where like you're going through everything. I mean, clearly I could talk about public health till the cows come home, but one of those things where if it's searching, or if it's purely educational.
Yeah.
Yeah, that
Versus
could
the
be
variance.
less often for sure,
Yeah,
Yeah.
I mean, like I said, I love talking about public health, so it's not.
unless something really urgent comes up that has to
Yeah.
be disseminated as
Mhm.
widely as we can figure out how to disseminate the information.
Mhm. And that's the biggest question with public health in general, I feel like, is how do we get the word out and how do we get people to listen?
Yeah, it's probably the most difficult issue that we face.
I agree. I agree.
I mean, every time if I go anywhere and I mention anything about the Pilgrim nuclear reactor, most people will say, I never heard anything about this.
Mhm. Mhm.
This is news to me. It happened at the MHB meeting.
Mhm.
They started talking about it and a couple of people said, how come this is the first I ever heard of this? And I live not too far away.
Mhm.
I guess you don't look at the stuff where this is going on now. So, anyway, if there's no other old or new business, we will ask then for David. Would you take the honor of asking us in a motion to adjourn?
Motion to adjourn.
I will second that motion.
Is there any further discussion about continuing the meeting? No? All right. In that case, I'll just call the roll. Amy, yes or no?
Yes.
David,
Yes.
Lorenzo,
Yes.
Deb,
Deb had technical difficulties.
Deb's gone.
Yeah.
Clearly, that's a yes.
Okay.
She had a technical difficulty, she said. and she-
Okay, myself, yes, it's unanimous with one of our current voting members absent.
All right. Thank you very much. Have a
Thank
good
you.
night.
Bye-bye.